Good morning. Today, I have the privilege of announcing our 2022 COVID-19 healthcare fraud law enforcement action. This action highlights the Department of Justice's coordinated efforts to prosecute COVID-19 healthcare fraud schemes across the country. These schemes were designed to exploit the COVID-19 pandemic, an unprecedented public health emergency. They harm our critical healthcare benefit programs, such as Medicare, as well as government financial assistance programs designed to help Americans get testing and treatment for COVID-19. While millions of Americans were suffering and desperately seeking testing and treatment for COVID-19, some saw an opportunity to profit by committing alleged frauds, laundering taxpayer dollars through shell companies, and buying luxury goods and lavish homes. The cases announced today involve defendants who allegedly misused patient information from COVID-19 test sites to bill for other unnecessary services and testing. Defendants who allegedly misappropriated money from the CARES Act Provider Relief Fund. Defendants who allegedly engaged in telehealth fraud. And defendants who allegedly sold fake cures and fake COVID-19 vaccination record cards. Specifically, in 9 federal districts across the country, prosecutors brought criminal charges against over 20 defendants for COVID-19 healthcare fraud schemes that resulted in over $149 million in false billings. It is, of course, important to remember that the charges I've referred to today are allegations. The defendants are presumed innocent until they are found guilty beyond a reasonable doubt. But today's announcement builds upon months and now years of work by many devoted public servants. This is possible only because the Criminal Division's Healthcare Fraud Unit, with its U.S. attorneys' offices and law enforcement partners, have worked around the clock since literally the first days of the pandemic in March 2020. This effort has involved unprecedented coordination with an interagency working group of law enforcement and public health agencies to identify and prosecute COVID-19 schemes. This whole of government response led to the initial May 2021 COVID-19 healthcare fraud law enforcement action, and continued with the establishment of the Attorney General's COVID Fraud Enforcement Task Force. We have taken those efforts to new heights today. Today's enforcement action sends a clear message that we will stop at nothing to root out COVID-19 related healthcare fraud wherever it may be found. The Department of Justice is committed to protecting the American people and the critical healthcare benefit programs that assist them during this national emergency. And we will hold those who exploit such programs accountable to the fullest extent of the law.
Americans have rallied together to help us get through this pandemic. However, some bad actors have found ways to exploit the situation for their own financial gain. Not only do these schemes undermine critical public health efforts, they put people at risk and threaten the integrity of federal healthcare programs. The Department of Health and Human Services Office of Inspector General is aggressively pursuing fraud and holding wrongdoers accountable. This sweeping enforcement action is testament to the hard work and dedication of the HHS OIG investigative team and our law enforcement partners at the federal and state level. Safeguarding federal healthcare programs and protecting the beneficiaries they serve remains our #1 priority.